Hi, my name is Aaron Hale, and I'm in Family 150 in Section 04. And today I just wanted to discuss a little bit about the career profile that I chose to do. And the title of the career that I chose was Social and Community Service Manager. So a Social and Community Service Manager, they really coordinate and supervise service projects and also community organizations. They also will direct and lead staff who provide social services to the public. And I had the opportunity to look up some information about various careers that are kind of local or farther away. And I found one that was at North Shore Senior Center, and this was in Northfield, Illinois. And I got to learn a little bit about their center and what some of the things they do on a daily basis. And so let's talk a little bit about the working environment within this career. So there's a variety of settings that you would work in. Sometimes they would be in clinics or hospitals, even positions in offices or shelters. You also help plan for community projects outside as well. So this job is considered full-time and occasionally working late depending on certain projects that you may be involved with. Some social and community service managers will focus more on a certain population of people, such as homeless communities or children for that matter. Occasionally there's work that needs to be done which will focus more on the problems of an individual, such as maybe helping someone find a job or whatnot. So some of the typical stressors are much like any other career. There are always going to be some stressors within a career, I believe. I think with this career path, it really depends, again, on the day or time period in society, really. For example, for those who are working on fundraisers or budgeting, it could be pretty stressful trying to crunch all those numbers on time. This can be particularly stressful excuse me, if the community or country you are working in has some economic droughts. I can imagine the people in whom you work with can be stressful depending on their situation, or maybe they don't want to listen to your advice that you're giving them. Oftentimes there's a significant caseload that you'll have to meet deadlines or complete all the paperwork on time, properly document and do billing as well. You have to manage priorities, changing priorities often and in various cases at one time. And there's traveling throughout the communities, which you'll most likely do, so that could be stressful for some. While I was trying to search about the many benefits that come from this as far as healthcare and retirement and financial wise, I didn't find too much information about this subject. I suppose it comes down to which organization that you work for, government group, state, or local. But really I didn't find anything for this specific career. I'm sure it has to be with the organization, but in some cases it could be that you'd have to find your own health care or kind of savings. So some of the common job tasks there are a variety as well. Some may be focusing on recruiting or hiring, training new members of the staff, and others may be out in the community helping programs. The duties really are based on the size of the organization and individual that the individual works for. So typically, social and community managers will discuss with members of the community what types of programs and services are needed. They'll also design and oversee programs to meet the needs of the community. They'll suggest and carry out improvements to programs and services. They'll also manage budgets and acquire funding for programs through the budget or fundraising process. So there are educational requirements for this career. The minimum requirement is a bachelor's degree in some kind of human relation degree, such as social work, public administration, family studies, or some other related field. Most employers will want you to have some work experience, especially if you're just with a bachelor's degree, because they really prefer a master's degree. So if you're coming in with a bachelor's degree, they really want to see that you know what you're doing, basically, with work experience in a certain field. Starting salary, like most careers, again, it really depends on demographics. Some areas of this job will pay more than others, and depending if you work for local or state government, individual services, rehabilitation, or residential care facilities, the average is about $57,000 annually. but you will probably start off closer to around 30,000. But they also said that the top, about 10%, make over 96,000. So it's a big range that you can move from. So due to the aging population, employment is expected to grow much faster than the average for all occupations. Because of the increase of elderly people in communities, there's going to be a need for these programs for them. So they'll also need people to develop certain programs for the elderly and others. So although this occupation is growing rapidly, there may be limitations due to budget cuts in some states and local governments as well. So that's a little bit of information about the career I chose. Thanks for watching.